Small palpebral fissures, absent philtrum, thin upper lip border. It's fetal alcohol syndrome. In old age, if there is sleep disturbance, loss of energy, loss of weight, loss of interest, and loss of concentration, it's major depression. It's not just aging. So we treat by antidepressants and CBT. Need to be center of attention, dramatic, and shifting emotions. So it's histrionic personality. Hyperpigmented velvety lesions on flexural areas like neck, axilla, and groin. Acanthosis nigricans. Young women have this in DM and PCOS. Erythematous vulvar erosions, oral erosions, serosanguinous vaginal discharge, postmenopause. Erosive lichen planus. Acute cervicitis. What's the treatment? Ceftriaxone and azithromycin. Metformin taken for more than 5 years. What's the complication? Vitamin B12 deficiency, which may present with ataxia, neuropsychiatric changes. Von Willebrand disease may cause postpartum hemorrhage. Uterine atony, uterus enlarged and boggy, not firm. Urge incontinence. Treatment is antimuscarinic, but if it doesn't help, then beta adrenergic agonist. Postmenopause, endometrial cells on pap test. Diagnosis, endometrial malignancy. So do endometrial biopsy. Pneumonia in cystic fibrosis. In children, due to Staph aureus. In adults, due to Pseudomonas aeruginosa. Retic count, elevated in thalassemia, normal in iron deficiency anemia. Ankle brachial index, normal zero point 0.9 to 1.3. If more than 1.3, it's calcified vessels. Elderly, loss of balance, hand tremors, slow movements. It's Parkinson's disease. Diagnostic test is physical examination. Epigastric cancer, diagnostic test EGD. A patient who presents with stroke symptoms and also has polycythemia, we suspect renal cell carcinoma, which is EPO secreting tumor. So we do CT abdomen. Do echo before treating with what drug? Trastuzumab, because it is cardiotoxic drug. BPH treatment, alpha adrenergic blockers like terazosin, tamsulosin. Most important prognostic factor in breast cancer treatment is tumor burden, which is TNM staging. Quick quiz. Small palpebral fissures, absent philtrum, thin upper lip border, fetal alcohol syndrome. In old age, sleep disturbance, loss of energy, loss of weight, loss of interest, loss of concentration, major depression. Need to be center of attention, dramatic and shifting emotions, histrionic personality. Hyperpigmented velvety lesions on flexural areas, neck, axilla, and groin. Acanthosis nigricans. Erythematous vulvar erosions, oral erosions, serosanguinous vaginal discharge, postmenopause. Erosive lichen planus. Treatment of acute cervicitis, ceftriaxone, azithromycin. Metformin taken for more than 5 years. Vitamin B12 deficiency. Von Willebrand disease may also cause postpartum hemorrhage. Uterine atony, uterus would appear like enlarged and boggy. Treatment of urge incontinence, antimuscarinics, and if it's not helping, then beta adrenergic agonist like mirabagrine. Postmenopause, endometrial cells on pap test, endometrial malignancy. Pneumonia and cystic fibrosis is caused by children, Staph aureus, adults, Pseudomonas aeruginosa. Retic count, in thalassemia it's increased, in iron deficiency anemia it's normal. Ankle brachial index normal, 0.9 to 1.3. Elderly, loss of balance, hand tremors, slow movements, Parkinson's disease. Diagnostic test for epigastric cancer, EGD. Cerebral infarct and polycythemia, renal cell carcinoma. Do echo before treating with which drug? Trastuzumab. Treatment of BPH, alpha adrenergic blocker. Most important prognostic factor in breast cancer treatment, tumor burden. Thank you.